Hello, my name is Joel Russo, and I'm here today to talk to you about skin cancer, some of the types that you can get, as well as some preventatives to make sure that you don't contract skin cancer. It's very important to take care of your skin, and I'm hoping this presentation will give you a little bit of idea of why that should be. And I'm just going to start this off by saying a couple facts about skin cancer. Skin cancer is the most diagnosed cancer worldwide. In America, 1 in 5 people are expected to have skin cancer by the age of 70. More people are diagnosed with skin cancer each year than all other cancers combined. Recent studies have shown that both deaths and diagnoses have been increasing over the last decade and are only expected to continue to increase for the next couple years. With these statistics in mind, it's important to know the factors that put people at risk to help people avoid contracting skin cancer. There are 2 factors that go into contracting skin cancer: genetic factors as well as environmental factors. Some genetic factors that increase your risk of skin cancer include lighter skin, red hair, as well as freckles. People with lighter skin are just more susceptible to burning, which does increase your risk for skin cancer, compared to someone who has darker skin who always tans and doesn't burn, but that doesn't mean they can't contract skin cancer. On top of that, people with red hair and freckles carry a variation of the MC1R gene. This variation increases the risk of melanoma, a skin cancer that I will discuss later on in the slides. But for environmental factors, the main one you should be worrying about is just ultraviolet rays from the sun. And long exposure to the sun does damage your epidermal as well as your dermal layer of your skin, creating mutations, so it's just best to try to avoid long exposure to the sun, but more about prevention later on in the slides. Now, benign skin lesions are very common in people. Everyone has them. And types of these can be freckles, nevi, or more referred to as moles, or lentigo. And these are harmless unless symptomatic. The most important thing to note about these is that these can become cancerous when exposed to UV rays for a long amount of times. The most common ones that do become malignant are lentigo as well as nevi. Now for the next couple slides, I'm just going to offer a warning that some of these images are kind of gross just because we are dealing with skin cancer in some types. So if you're too kind of squeamish when it comes to gross things, I'd recommend just listening rather than watching. With that being said, that brings us to the first skin cancer that we're going to be talking about today, which is basal cell carcinoma. And this is the most common one you're going to be finding in people. It's estimated that 3.6 million people are diagnosed with this one every year, and like I stated before, it's always constantly increasing each year. And this is damage to the basal cell, so the UV rays come into your skin and destroy the basal cells, which are the bottom layer of the epidermis, causing mutations, causing it to become cancerous. And this can take on several appearances. This could be open sores, it could be a pink growth, it could be red patchy, it could be a shiny bump. I gave a couple examples on the right of what it can look like, but not every case is going to look the same. So it's important to always check weird growths as well as sores that aren't healing to make sure those aren't cancer. So this is a very slow spreading cancer, but it is a very invasive one as it goes deep into the skin where it is. So that's why it's always important to get treatment as soon as possible. Getting treatment sooner rather than later is always better, with the most common treatments being excision, Mohs surgery, as well as electrosurgery. Now, I only listed 3 just because these are the most common ways that they treat basal cell carcinoma, but there are many other ways that can be treated if someone so chooses to. The second type of skin cancer we're going to be looking at today is the squamous cell carcinoma. And this is the second most common one you're going to be finding in people, with about 1.8 million cases a year. And that number is always going to be increasing, as I said before, with recent studies expecting that to go up. And so this is damage to the squamous cell, which is also found in the epidermis, and it's similarly named to the basal cell just because, both in the epidermis. And characteristics for this skin cancer, it's going to be kind of scaly, open sores, it's rough to the touch a little bit, and sometimes it can have wart-like bumps. With a couple of examples I put on the right, you could see how it's kind of rough, looking scaly a little bit. And just like basal cell carcinoma, all of these are going to look different, so you're not too sure what's cancer or what's not. So it's always important to go get these checked out by a doctor and do monthly checkups on your skin to make sure none of them are growing. Now, people who have received organ transplants are more likely to get skin cancer, more specifically the squamous cell carcinoma. It's unknown why that is, but doctors are led to believe that the drugs they are taking after the organ transplant leads their bodies to not being able to fight cancer as well, being more susceptible to that. With that being said, squamous cell carcinoma is one of the more deadly ones, causing about 15,000 deaths a year. So it's important to get it checked out and get it treated sooner rather than later. With similar treatment methods to basal cell carcinoma, the most common ones you're going to see are excisional surgery, Mohs surgery, as well as electrosurgery. Again, there are many other ways to be treated, but these are the most common ones and the most effective ones. And this brings us to the last skin cancer I'm going to be talking about today, which is melanoma. And I know I've been talking about how skin cancer as a whole and deaths as a whole have been increasing per year, but melanoma is a special case as it is increasing a lot faster, seeing a 5.8 increase in diagnoses as well as a 4.8 increase in diagnoses this year. Melanoma is the damaging of the melanocyte, which causes a mutation which turns into cancer. Much like every other skin cancer, melanoma can take on several different forms as well as sizes, so sometimes people are unsure whether it's melanoma or just a regular mole. So there's a method that you could go to check about these things called the ABCDE method. Right? They're very thoughtful naming system. But these do stand for something. A stands for asymmetrical, B stands for border, C stands for color, D stands for either dark or for diameter, E stands for evolving. With this method, you just go down the list to check if anything is out of the ordinary or if any of these criteria match your suspected melanoma spot. So for asymmetrical, usually melanoma are not symmetrical. You usually draw a line where you suspect it is. Of course, you could probably see it just by looking at it. But B for border kind of goes hand in hand with that. The border is not always going to be round. Usually in these cases, they're more of like bumpy, kind of rough compared to like a smooth round circle you might find on a mole. C for color. Now most moles are black, but at the same time melanoma can come in two colors, and that's a very telltale sign that it is melanoma. If it's a darker black and then it's a brown on the outside, then that's very likely to be melanoma. And so D for diameter or dark kind of already addressed in the color, but then D for diameter, if it's bigger than a pencil eraser, you have a potential problem there. So it's important to go check that out to see if it's big, or E for evolving if it's getting any bigger, right? You want to take pictures to see if it's evolved in a way where it's a different color, a different shape, growing bigger, right? It's always important to catch the melanoma before it gets out of hand. And this is one way just to get closer to treatment, right, if you need it. So going down this list kind of can give you a good idea whether or not you have melanoma or not. Just to give a couple of examples, if you look on the right for the border on the bottom one, how it's very bumpy, how it goes up and down compared to the top one where that's a little bit more circular. All melanoma is going to be different, so that's why it's important to go down this entire checklist. It might not fill out the entire criteria, but it's important to check. And C for color, if you look at the top one, how the top portion of it is a lot darker than the bottom of the brown, right? So that's kind of what you're going to be looking for if you do this checklist. And this checklist is very important because the earlier you find the melanoma, the easier it is to treat. In fact, there's a 99.5-year survival rate for people who do catch it early, and that drops all the way down to 41% after 119 days after the biopsy. So you can kind of see now why it's important to catch it early before it's too late. 70 to 80% of melanoma cases come from normal-looking skin, with 86% of these cases coming directly from the sun and its UV rays. On top of that, your risk increases to double if you have sunburnt more than 5 times in your life, so it's important to take care of your skin. Treatment for melanoma is a lot different than the last two cancers listed just because of how aggressive it is in nature. If left unchecked for long enough, it gets deep into the skin, making the first option, excision, not available. They then resort to chemotherapy, which is killing of the cells, and immunotherapy, which is administering a synthetic version of the immune system to try to fight off those tumors. The most recent innovation when trying to cure melanoma comes with nanotechnology, and that goes hand in hand with the other immunotherapy and chemotherapy processes. Using this nanotechnology alongside immunotherapy as well as chemotherapy has shown promising results for the future of treatment of melanoma. Although proven successful, this was only tested in rats carrying human cells of melanoma. So more research needs to be done into the future to fully test if nanotechnology and chemotherapy can work as a true stop to melanoma. And this brings us to the last point. What can you do to stop getting skin cancer? Biggest one, wear your sunscreen when you're outside. That drops your risk by so much just because most of these are UV based. So wearing your sunscreen blocks out the UV rays. Simple as that. Limit your time in the sun if you aren't wearing sunscreen. That's also very important. Indoor tanning beds are the worst thing you could do just because that's UV light straight on your skin. So I'd recommend going away from those and not using them. Monitor benign skin lesions. Take pictures of your moles. See if there's any growth in there. If there's any concerns, do bring that up to a dermatologist or a doctor. And that brings us to the last point. Get checked as soon as possible. If you do have any concerns or if you have seen growth in one of your moles, it's better to get checked as soon as possible just so it doesn't get out of hand. With that being said, thank you for listening.